Okay, so this question is asking in relation to capsular contracture, if your implants are under the muscle, is that better? So in general, when you're talking about a breast augmentation, there's a lot of different decisions we make. The incision location, the type of implant, where the implant sits, all of these things will affect your rates of capsular contracture. So it's really hard to say exactly what matters the most and what combination of things is the best to reduce contracture, because a lot of the studies where they studied capsular contracture, these things weren't well controlled. So if you look at all of the studies that we have in the literature about capsular contracture, there are certain things that we believe make the rates higher. So over the muscle augmentations, over the muscle is worse than subfascial. Those are both types of over the muscle augmentations. Incisions around the areola, incisions in the armpit, not using Keller funnels, and not using the right irrigants to clean the area when we're putting the implant in. There's also some other things like putting a little tegaderm over the NAC, also will reduce your contracture rate. There's a lot of things that we can do, and in combination, all of these things together can reduce the rate of contracture. So many of the older studies, they weren't doing all of these things, or they were comparing a lot of surgeons doing different things together, and that doesn't tell the whole story. So with the recent Motiva approval, their capsular contracture rate was like less than 1%. And so people will compare that to the prior studies many, many years ago on Allergan implants and like Mentor implants, where the contracture rates were much higher, like I think up to 14%. And it's not the implant, it's how we do things that seems to matter. And so we do things different now, which is more successful in minimizing contracture versus what we did back then. So in summary, yes, under the muscle augmentation, in theory, according to the best studies we have, has lower rates of capsular contracture. But if you do all of the right things, the capsular contracture rate is quite low. And it's important as a patient that you discuss all these things with your surgeon, because capsular contracture is not the only concern with breast augmentation. And so sometimes when you give one thing, you lose another. And you want to tailor your breast augmentation to minimize the things that are important to you and maximize the things that are important to you.